That's with that. Good evening. I have to be so careful with this. I keep pushing it on my buttons. It's not good. There we go. Okay, enough with that. Welcome to Back Care Pilates on week 3. So this week we're looking at the hidden and forgotten muscle that is crucial to spinal stability, but also gets weaker when we have a weak back. So they kind of work and they're interacted together. This muscle is, of course, your pelvic floor. And if you do any kind of core work, you know that the core is the floor, the top and the sides. All right. And without the floor engaging properly, you're going to be limited to how strong your core will be. This is going to be a more of a workshop thing where we're going to try a few things rather than doing a whole workout. But we will be doing some stretching and relaxation within this session. Please make sure you've got nice warm layers on because there'll be a lot of sitting and listening. Now, with all of the back care sessions so far, I have told you, try not to watch me, okay? Because it should be more about you and about how you feel. And if you have a back issue, then you know some days your back is good and some days your back is not on the right wavelength. You know, could be you've done something the day before, you've done a bit of gardening, you've pulled your back, or maybe you've even been on a long journey sitting down in a car. I remember once travelling back from France and we were late for the ferry and we just drove for 8 hours. I couldn't walk. It was terrible. So I understand what it's like. The way that we learn to get the back to be better is to tune in to where our back is feeling happy. Okay, because sometimes we can just carry around that label and we've got a bad back, and we'll do compensatory movements that actually don't help to strengthen the back, whilst at the same time not understanding why our back gives way. And that kind of frustration makes you feel less confident about trying things like going for a long walk or trying something different. So it's the same with the pelvic floor. The pelvic floor muscles essentially secure the lower part of the spine to the pelvis. Okay, so they wrap around that sacrum and coccyx area, they work around the sacroiliac joint, and they stabilize the whole internal part of the pelvis, so that you're not only having the muscles on the outside, like the glutes, but it's the inside muscles. So if you can think of the inside and outside muscles both being strong, then we're on to a winner. The pelvic floor muscles are exactly the same in males and females, apart from the fact that we have one more opening, okay? Other than that, the attachment points, the direction of the muscle fibres, the density of the muscle fibres is exactly the same. So this week I've written 2 posts, one on pelvic floor in general and one on prostate cancer, because when we have prostate cancer, then we can have other issues with pelvic floor. Saying that, 9 times out of 10, if your pelvic floor is weak, okay, you're probably going to have some kind of repair, and you probably need to go to hospital for that. But what they found is that working with Pilates helps to strengthen your pelvic floor, so that if you have to have surgery, your pelvic floor is in a better place and you recover quicker. And there is a point of recovery from pelvic floor issues with the both treatments working together. If you do have serious issues, you really need to go and see Women's Health Physio, and you can refer yourself on the Ceredigion, if you live in Wales, on the Ceredigion physio referral, and just ask for Women's Health Physio and they can really help you with exercises. But they can only do it for 6 weeks. So after the 6 weeks, you need to find a way of kind of continuing to work. So all of these things together mean that we can sometimes ignore it because can't see it. You only notice it when it doesn't work. So if you're having things like any kind of incontinence problems, and remember there are different types, so you can have like an urge incontinence where it's, you know, you get to the toilet and you can't stop weeing before you sit down. You have a dribble incontinence where you just seem to be leaking a little bit of urine all the time and you can't stop it because you don't even know what muscle's working for that. Or you can have a stress incontinence where you laugh, cough, sneeze, jump, and you get a leakage of water. Or you can have all 3, or you can have 2, or you can have 1, or you can have none. Just depends. The other flip side of having this incontinence area is that you could have a hypertonic pelvic floor, and this is where you have problems evacuating your bodily fluids because the pelvic floor is in spasm. This causes chronic back pain as well as chronic pelvic floor pain. And the last thing we want to be doing then is really over tightening, because it can cause it to flare up. So these exercises that we're going to do in the beginning are suitable for both. And then when we do the work on the floor with the mat, if you have a hypertonic pelvic floor, listen out for the alternatives I'm going to give you so that you don't get that aggravated knock-on effect. So if I asked you to bring a towel, okay, mine's over here. Okay, so one of the easiest way to kind of work and find out where your pelvic floor is to get a towel and to roll it up, all right? It doesn't have to be big like this. I personally like to have it like that. That's my preference, okay? It's up to you. And you're going to sit on it, all right? Hence why I asked you to bring a chair. So you put that on your chair and you sit on it, okay? So I'm going to turn around now. So by sitting, that's why I've asked you to bring your own towel. When you sit on this now, you should feel where the coccyx is of the spine, yeah? And you should be conscious of where the front of the pelvis is. In the middle, where you feel that towel pushing into your body, is where the pelvic floor is. This is particularly useful for women or men who have a hypertonic pelvic floor. Now, this could be because of scar tissue. Maybe you've had a episiotomy, maybe you've had a hip replacement, maybe you have prostate cancer. Anything where you get an excess of scar tissue that's pulling your pelvic floor in one direction. You don't actually have to do much for this. You can sit on it, but what I find really works well is to roll back so you feel your coccyx, and then roll forward so you feel the front of the pelvis, and then find a place in the middle. Now, you know when we do the pelvic rock, so you can either sit with your feet together like this and rock from one hip to the other, or you can have your feet close in and rock forwards and backwards, or you can have your feet onto the floor. Just depends on how much pressure you can cope with. Sometimes you'll feel like it feels really painful, so make the roll a little bit smaller. What we're also going to do here is try and do the breathing exercises. And when we're doing the breathing, when we're standing up, I'm often saying to you, relax the pelvic floor and contract the pelvic floor. And because the towel is there, you know, like when we put the towel on our lower back, sometimes when we have the towel in this position, it gives us something to work with. So it's up to you. You can have your feet in pelvic rock position, tippy toes, or flat feet, whichever one works for you. I prefer this one personally, but you know, it's your own thing. Hands onto your legs, roll your shoulders back and down. So you want to start, as we do in Pilates, with your sternum lifted up, and so that you've got the side in a nice strong position. You want to take a deep breath in, and then you want to breathe out and draw the sides of your body, but also feel that you're trying to lift your pelvic floor away from your towel, or that you're trying to compress against the towel. Just depends on the sensation you feel. But on the in-breath, you want to feel the pelvic floor soften and give. So for those of you with hypertonic pelvic floor, this is your key one, all right? So you go breathe in, and you release into it. So think about, you know, ironing something out, or smoothing something, or stretching something, rolling pastry, anything that involves stretch, and then breathe, and then just hold it in, yeah? And then release. So you have the release in between. So sitting back, take a deep breath in, breathe out, and release. Okay, so you're going to take that away. Okay, I'm just putting it behind me. And when you're now sitting, you should still be aware of the sensation of that towel in the place it was in, so that you can practice that movement again. So it's a breath in, Breath out, try and lift. Now you'll notice when you lift, you will get some work through the abs, but what you shouldn't try and do is squeeze your belly in tight, okay? So try again, deep breath in, breathe out and release. Okay, I'm going to turn my chair around sideways so you can see. You've noticed I've put my towel there onto my chair. So this is called slump, all right? So with this, you slump into your chair, like you've got terrible posture, and then you lift up and you sit up, okay? So you round your back and slump into your chair, chin tucked in, and then you roll forwards and you sit up. Does that make sense? Roll, slump, slump, slump. Now you can have a bigger towel or a pillow behind your back here. Then roll up. And then again, roll, roll, roll. So then remember we did like the north, south, east and west. So this is like doing north and south, where you're moving the pelvis in a different position. So where we had the towel, we had more pressure this way. This is a different kind of movement with the pelvis, where you're rolling and releasing. From there, scoot. So one butt cheek is on the chair and one leg is free, okay? Now, if you feel like you're going to fall over, hold on to the other side of the chair, yeah? So you hold on like this, hold on to your chair. Open your arm up, okay, and lean, and then bring it down. And then up, lean back, and bring it down. You've got one more go. Up, lean back, and bring it down. Going to try onto the other side. Now what we're trying to do here is warm up through the front of the pelvis in this position. So you're looking for your thigh being slightly back away from your hip, okay? So not right underneath your hip. Stretch your leg back. Then you're looking to sit up with it, and you should feel that opening through the hip. Quite often we're in this position and you can see how my pelvis changes position when we're tight in the hips. Okay, so you're reaching up and then release down. Okay, turn around and face me. Bring that towel back and we're going to be sitting onto the towel again. Okay, so this time I want you to sit with your feet close together, okay? You're going to hold onto the chair, you're going to pull your shoulders down, and then you're going to do that slump and then roll up. Okay, so you're going to go slump and then you're going to roll up. Now, but you're going to keep your hands holding onto your chair. Okay, slump and roll up. Okay. This kind of movement where we start to get what we call in the lumbopelvic region, between the pelvis and that lumbar spine, but also focusing on the muscles of the pelvic floor, will help us kind of tune into where our body's working. These are great little exercises that you can do without doing any kind of warm-up. You don't have to be in sports kit. You don't have to, do anything. If you're feeling like you could do, I've got 5 minutes, this is a great set of exercises to do, okay? So sit on it, side to side, take it away, put it behind you, roll and slump, yeah? Then sit on it again, hold on, roll and slump, okay? I just want to come up to standing. I'm going to move the chair out of the way. And, I've still got my socks on. Here we go. So from here, what you want to do is to think about that rolling forwards, when you did the rolling forwards and back, where you did slump and lift, you want to roll forwards and back. You want to feel like you're rolling and tucking your tailbone underneath. That changes the position of the front hip bones here, all right? So you've got here in the front, your ASIS, anterior superior iliac spine. You want to push it forwards. Now, we used to teach this. Imagine you've got headlamps on your car. Shine the headlamps forward. But essentially, why your pelvic floor plays on your back is this. If it's tight, it pulls you into this position. all right? And then your back has to take a lot of the strain. So you can try and straighten up by lifting here, but unless you make the adjustment in the pelvis, what happens is you get the lift here and you'll get increased pain in this area of your back. Okay, so not low down, but here. And that is usually because the pelvic floor muscles can't pull the pelvis into position. So if you think about where your tailbone is, okay, it pulls the spine forward. So it kind of is like a rope that ties it to the front. The final part before we go onto the floor is to look at the role of the abdominal muscles down the front here. Okay, so find your rib cage, find where it kind of meets. It's probably just underneath your bra, roughly about your heart height. Don't panic too much about the attachment points. But it connects from here in two bands of muscle that start wide and end up narrow onto the front of your pelvis. We know it pulls your body up, but it is really crucial for helping your pelvic floor get into position. So it pulls the pelvic floor and it helps to adjust your pelvis. Now we know that when your pelvis is in this anterior tilted position like this, you're more likely to have pelvic floor issues. They don't know whether this position causes the pelvic floor or a weak pelvic floor means you can't stand up. All right, so there's a lot of debate about which is the most important thing. When you're working that pelvic floor, think about that rolling forwards that we were doing and pulling up, and then think about zipping up. Okay, so we quite often talk about the zipping up. So when you've got your jeans on, yeah, your jeans zip starts low down and it zips up roughly to your belly button. That's what you want to practice as well. There are many different ways to work your pelvic floor, okay? But we haven't got time to do them all. I've done a whole 6-week course on pelvic floor, but let's have a look at some of the basics for why it makes a difference to your back, as well as all your other issues to do with a weak pelvic floor. The final element for the tight pelvic floor, okay, so you can have a tight pelvic floor and still be incontinent, by the way, is that you will find a drag to one side. So say like if you had a hip operation on this side, that tightness might pull your pelvis slightly this way. And what you'll notice is you'll have one hip slightly higher than the other. So you might go to the osteopath and they might say one hip is slightly higher than the other. It could be, I'm not saying it always, but it could be because you have that tightness of the muscle, it's pulled the coccyx slightly to the side and tilted and sometimes rotates your pelvis. That makes then everything else far more difficult. So to do that, we need to release and stretch the pelvic floor. The best way we can do that is to go to Women's Health Physio, but that's not always the option. So we can do it with some deep breathing and controlled breathing. Placing your hands onto your rib cage. I will finish in a minute. Take a deep breath in and notice there's a gap here between your fingers. Breathe out and bring your fingertips to touch. Now, in a hyperpressive breathing state, you keep the tightness, the contraction on your abs, and you take a breath in without moving this part of the rib cage. So you've got to breathe up here. So you breathe in again. And because you're breathing up higher into the chest, what happens is like it pulls a vacuum through your body and lift your pelvic floor. This is perfect if you've got any kind of prolapse. If you've got a uterine, a bowel or a bladder prolapse, you want to make sure you're doing that, especially if you're then going to do a sit-up. Because otherwise, if your pelvic floor is weak, tilted and pulled to the side, and then you cause a downward force and pressure by pulling your upper body weight, you can make it worse. And we don't want to be doing that. So I'd like you now to please get your mats out. We're going to go through some of the exercises. If you're not sure, you might like to use your chair to help you. And what you can do is you can have your feet or your legs onto your chair for when we're doing the pelvic work. And then you can just put them down to the side for everything else, okay? So it's up to you. You don't have to have your chair. If you're in the lounge, you might want to put them on the settee, put them on the dog. You know, all of those different kinds of things. I'm not going to bring my mat out because time. Please have your towel and your band with you. And I will take my socks off. Here we go. Okay. So I would suggest now, with your towel, you go back to using it as we have been doing underneath your lower back area. Okay, so make sure that it's in that space between the pelvis and the rib cage. Having your feet hip distance apart and having your hands down by your side, take 3 breaths in. And I want you to remember that sensation we had of relaxing the pelvic floor and then tightening the pelvic floor. Remember, you will feel some tightness around your abs. You even will feel a little bit of tightness around your glute muscles, but really focus on the pelvic floor unless you're hypertonic. So what you do is you take a breath in and you stretch, and on the out breath, you really focus on your abs. Okay, don't touch that pelvic floor area. Okay, so you want to take a breath in, breath out, hold and tighten. Feel like you're drawing the stomach muscles together. Okay, think about that attachment front and back. Think about that zipping up position that we talked about. And then just release down. Okay, so you want, and again, it's sometimes easier to do this with your feet up. You can even put your feet on the wall. You know, you don't have to have it on anything else. So it's a deep breath in. Don't forget to stretch. Breath out, and then start to lift. Now if you've got the towel, try and feel like you're doing that slump into the towel, yeah? So feel like you're slumping into the towel and that you're doing a little bit of that zipping up. And then you can try and think about trying to bring the hip bones closer together. You can't do it, but have that sensation of pulling in together and then release it. The magic ingredient here are your toes. So if you push your big toe down, it helps to activate your pelvic floor, all right? So you want to go breath in, breath out, and tighten. The other thing you notice will happen when you're doing your pelvic floor work is as you connect your pelvic floor, your eyes go up. Don't panic. Apparently it's a good thing. And then release. Okay, so we're going to practice the hypertonic breathing. Take a breath in. Take a breath out. Now, keep it tight. Take another breath in and do that tightening that we did. Zipping up, pushing, slumping. Then take your hands behind your head so you keep that tension, don't let it go. And what you can do is pull your head and shoulders up by pushing your rib cage down, but sink your belly. Okay, so feel like your belly is coming into that zipping up position. So if you lived through the 70s, you know when your mum washed your jeans and they were too tight, that feeling of really pulling your abs in, and don't forget about pushing your big toe down. What you don't really want to do is to pull in your head. So you kind of want to have that gap underneath your chin and look up towards the ceiling. Really open out the shoulders. You can have your arms in any position you like, as long as there's no force through that neck area, and then release down. Okay, so we do this stretch every single week, yeah? This is a really good way for stretching a tight pelvic floor. What happens is you've got this one stretch here and you open, yeah, in like a clam position before you roll over the other way. Now, as you're here, you're stretching through the back part of the pelvis, of the pelvic floor muscles here, the piriformis. So remember, the piriformis is part of that pelvic girdle. And then all you have to do is to roll into it. And what happens is that when you're taking the weight over this way, because this knee is angled slightly down, it gives that pelvic floor just that little bit of a twisty kind of movement that's going to help it just keep healthy. Okay, so we're going to do single leg slide, okay, normal Pilates exercise, but this is shown to be really effective at helping you strengthen your pelvic floor if you do all the other things first. So you have to do your hyperpressive breathe in, breathe out, hold, okay, keep it tight, breathe in again. Now breathe out and keep sucking your belly in tight, okay, and don't let go. Don't relax for a second. Keep your abs in tight, move your leg, keep your focus here, keep it in tight, and then release, and then let go. In the let go, let your pelvic floor relax. Frog stretch like this is quite nice, yeah? You can rock and roll your hips. You can do the cross-legged one if you feel that works for you. You can do this one, okay? But just be careful if you've got any kind of slip disc, because this is not good really for your back in this position. Or you can just do one and do your leg straight, or do one and your leg on the angle and pull this out on the other angle. So kind of play about with what feels good for you. Okay, arms up, shoulders down. Focus. Think about your pelvic floor and that slump and roll. Think about where the towel is. Breath in, breath out, tighten. So you zip up, keep the pressure on here. Slide that opposite arm and leg out. Keep your focus on your abs. So when you're here, I find if you really want to, you can keep your hands on this area. Think about that connection between the front of the pelvis and your rib cage, and you're tightening through that tailbone, pulling up, yeah, and then again one more time, and then recover. Okay, now go into your stretch. So the stretch element is just as important. You can do this stretch, you can do the other stretch, you can do both knees in, you can do rolling side to side, whichever one works for you. Okay, let's come up onto your hands and knees. Now, tabletop is a great way for us to be able to train the pelvic floor. The bridge is the best. I'm hoping I've got enough time to do the bridge afterwards. But I want to get you up and off the floor and practice this first. So on your hands and knees to begin with, okay? And I want you to think about where your tailbone is. So you take a deep breath in, you breathe out, you do the zip up, but as you do the zip up, I want you to feel like you're tucking your tailbone underneath. Now I've got whippets, and you want to think about a dog that's feeling sad that tucks its tail between its legs. That's the feeling. Don't worry if you feel your bum muscles clenching. We can go with that. Okay, so you can take a deep breath in, tuck under and hold. Now, from that position, straighten your leg out. Keep it tucked under, okay? So you don't want to be in this position, because the minute this happens, you can see how your tailbone lifts, and that stretches your pelvic floor. We don't want that to be in place. You want to tuck it under, and you want to lift your leg up and down. Now, this is a piece of research that said working your glutes in this position is really good to help to strengthen your pelvic floor. You want to keep your foot flexed, and you want to keep your tailbone tucked underneath, and you don't want to have that slump in your back, okay? So you want to pull up and hold, and you want to do that zip up all the time. Okay, child's pose. This is a really good way to stretch your pelvic floor. So when you're here, you go down into child's pose. Think about, okay, so diamond-shaped muscle. Think about the top of the diamonds attached to your coccyx, and the other part attached towards the front of the pelvis. It doesn't attach onto the pelvis itself. And you want to let it stretch. Now you can wriggle, yeah, and let that happen a little bit more. Okay, So you're going to come up. This time we're going to try it onto our elbows. All right. So in this position here, you're going to take your leg back. You're going to take a deep breath in, and you're going to do that tuck under. All right. So you don't let your belly. I think the thing to do is not let your belly hang out, but to really feel like you're doing that roll forwards and back that we did on the towel, yeah, or where we did the slump and tuck. So pull your belly in this position. It's a bit harder to do, okay? So you don't let your tailbone lift, tuck it under, and then you lift and lower your leg. Now when you're lifting and lowering your leg, you don't want to let your leg and your back relax. You want to hold it in tight the whole time. Really focus on making each move as hard as you can and not releasing and relaxing. And again, and then bring it in. Okay. All right, so you need your chair for this next one, which is why we got you up and down off the floor. We're not going to use the chair straight away. Oh, we can. We'll use the chair straight away. Here we go. All right. So you're having your feet onto your chair. If you haven't got a chair, put your feet against the wall. Have them hip distance apart. Hands down by your side. Take a deep breath in. Breathe out and see if you can do that pull and tilt with your pelvis. Yeah, and pull through the coccyx without moving. All right, then relax. So if you've got a hypertonic pelvic floor, you go breathe in, breathe out, and you want to relax a bit further. So whilst we're tightening, you're relaxing. And in this position, because the weight of the legs is up, it's probably why you're gynae position here, it helps your pelvic floor release. So here we go, deep breath in, breathe out, think about the tailbone, and you want to feel that zipping up. Now think about that where we talked about pulling the hips in together, and you want to feel that squeeze, and then you want to release. Don't forget, the release is just as important. So on the release, let your pelvis do that tilt forward. So you know when we did slump and move forward, let your pelvis tilt forwards. Your back can come off the floor for that bit. Let's try one more time. Deep breath in, breathe out, tilt that pelvis and suck in here. So feel like it's tight in the middle, yeah? Feel like your body's in contact, and then think about squeezing those hip bones together. Try not to tense your legs or your bum if you can, okay? It takes a bit of practice. And then release. Okay. So we're now going to bring your feet right onto the edge, okay? So your knees are over your body, and you're going to try and do that position here now. So you take a deep breath in, breathe out, and you try and tighten and control your pelvic floor without curling your toes. Okay, and then release. And then again, deep breath in, tighten, 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 and then release. Okay, place your feet down onto the floor. I'll tell you what, you need to move away from your chair a little bit. We're going to come back and use the chair in a second. The best way they found is to do the bridge. All right, so you've heard of Kegel exercises. Kegel exercises work best in bridge position. So your hands are down by your side. Remember about your big toe magic. Take a deep breath in, breathe out. You do your tilt, okay? And you push your big toes down. Now, when you come up, don't let go of the tilt, all right? So you don't do the tilt and then push. So you want to tilt and you want to feel like you are pulling your tailbone up. Now, if you can, what you want to do is squeeze your bum and lift your tailbone up. Squeeze and lift. Tighten your buttocks together. And again, one more time. And then don't let go until you're down on the floor. When you're down on the floor, then release. You might want to stretch your legs out. You might want to do your frog stretch, whatever you like. Okay? So hands are down by your side. Roll your shoulders back. Okay? Take a deep breath in. Just checking the time. breathe out, tilt, hold the tilt in position, all right? Don't let go. Push down with your big toe. When you come up, keep zipping up through the front. Okay, so people with hypertonic pelvic floors, you can do this and just work your hamstrings. Okay, hold it. Don't let go. Don't unzip. Keep it tight as you lower down. Then go into your stretch. All right, so just do anything just to release in between. The releasing of the muscle is just as important as stretching it. You want to start to tune in and focus about where it is and how it feels, okay, rather than, you know, panicking about everything all at once. Okay, we're going to do it one more time. So, hands are down. Think about where your coccyx is. Deep breath in, breathe out, and then zip up. Make sure it's tight, yeah? Rib cage down flat, abs are flat. Lift up, keep it tight. Push your big toe down, squeeze and tighten your pelvic floor. Keep it tight, and then lower down altogether. Okay, have a stretch. So this next one's not for everybody, all right? Because it's not easy. But what you can do is in this position, is lift up to your pelvic floor and control down. You can do it in this position as well. Okay, but it's not so easy to do and you can't get the same height. So we'll try this one first. If you're on the settee or on the dog, just be careful. So feet are hip distance apart, yeah, don't let your feet roll in. Take a breath in, breathe out, hold and tighten. This is going to switch off your legs working so much and you're going to really focus on your pelvic floor. Tilt and squeeze and then keep it tight when you lower down. So you can't lift very high in this position, yeah? Breath in, breath out, tighten, hold and lift up. How's that doing? And then release. So if you're finding that this is aggravating your back, okay, because remember they work very closely together, keep with your feet on the floor. If that one feels okay, you can try the harder one. So you bring your feet into this position. Make sure your chair's not going to tip, okay? So you don't want to push onto your chair, you want to push down onto it. Take a breath in, as you breathe out, tighten, push and lift. Hold the position and then come down, don't let go, and then release. If you've got a chair that's smaller, you might want to put your feet flat onto it. Try not to let the knees rotate in together. Try not to let the knees rotate out. Try and really focus on zipping up, tailbone forwards. We'll do one more. Deep breath in, breathe out, squeeze, tighten. You can lift just a little way, or you can lift the whole way up. Okay, keep it tight the whole way, and then release down. Okay, let's move your chair. Just watch my light. All right. So the other exercise, which is fab for your pelvic floor, is of course the clam. Where the clam is here, in this position, your piriformis attaches onto that hip joint here. It comes around your bum and attaches close to the coccyx, okay? So as it pulls, it's pulling inwards to your pelvic floor and then you're releasing down. What you want to make sure is that your feet stay together and that you don't kind of just do this movement without thinking. If you find it helps, put your thumb on your hip bone and move your fingers towards your coccyx. I'm going to turn around so you can see. Okay, so you put your thumb on there and your fingers towards your coccyx, which is roughly, here's your sacrum. You won't be able to reach really, and you want to feel like you're trying to squeeze in that linear direction. Okay? All right. So knees are in line with your hip bone is up, Don't lean back. Lean forward, feet together. Now, when you start to push up, you'll feel like a resistance. And I want you to really focus now on here, not on your knee. All right, so don't focus on your knee, focus there. So focus, pull in, and you might even feel it coming into this groin area, okay? Because it pulls internally and then it releases. Does that make sense? So you want to pull and release. And again, pull, focus on here and release. Do 2 more. Pull and release. And of course, the stretch to help this is to get into that pretzel position. But I'm always telling people to hold on to their legs. And I quite often see people doing this without holding on. The holding on is important because you want to bring your knee into your chest to keep the stretch in position and then allow your body to relax down. Okay? And then release. Okay, let's just do it quickly on the other side. Scoot around. Okay. So, thumb on your hip joint, point your fingers towards your tailbone, knees are together, don't focus on the knee lifting up, focus on this bit working. All right, so you want to pull and then you want to release. Okay, so you want to pull through that hip and you want to release. Be careful, remember that you're not rolling with it. And notice if one side is tighter than the other. So if you have that tightness on one side of your pelvis, yeah, have a think about, is it on this side that I'm super tight? Okay, and again, one more time. Here we go. Lovely. Okay, into the pretzel stretch, remember you hold your leg and bring it into an anchored position. So you hold it in position and then turn towards the ceiling. Release and relax. How are we doing? Happy days? And then let go. Okay. So up onto your hands and knees. The final one that we do in class every week is, of course, the cat and the camel. But I want you to focus on tailbone moving, start and finish. And to think about working through that tailbone all the time. So when you're here, tuck the tailbone under, then work through your back. When you're in this rounded position, release the pelvic floor and let it open. So again, think of that diamond shape. Think about it opening out. And then when you're tucking in, think about it closing in. Okay? So you want to tuck under, squeeze it in. And then release. And when you're in this dipped position, okay, so your tailbone is lifted and your head is up, feel like the pelvic floor is stretched out. If you find your pelvic floor is super tight, when you're in that camel position, you can do, you know, we sometimes do east to west on your hips. You might find that doing east to west on your hips just gives you that extra little bit of stretch. Okay, so we can have a go at that. So you want to take a deep breath in, breathe out, tuck under, hold your head in, then release from the tailbone, your shoulders, and then if you want to, do that east to west movement with your hips. Okay, sit back into your child's pose, drop your head down. Okay, remember we're going to come up to standing, take your time, come up in a way that suits you. Okay, I'll come up in a way that suits me. All right. So when you're doing your normal Pilates class, all you have to do is add that extra little bit in. So this standing position and your gait, remember when your pelvic floor is tight, when you straighten up, if you feel the pain here, you need to work your pelvis a bit more. All right, so that roll, tuck, slump, open, close, east to west. north to south works. All right, so feet hip distance apart. Breath in, zip up. Yeah, lift your rib cage. So when you breathe in now, think of the triangle opening. When you breathe out, think of the triangle closing. All right, so breath in, open. Open the pelvic floor. And then on the breath out, draw the pelvic floor in. So feel like when you're pushing your hands down, you're squeezing and tightening through your pelvic floor together. Once it comes in together here, do the zip up. All right? So here, let this bit relax. Let your pelvic floor spread out. Feel like your tailbone's going backwards a little bit. It can't go backwards, but feel like it's just releasing, okay? And then as you breathe out, pull in, okay? So pull in, tailbone under, and then zip up. Okay. Not the most relaxing of back care sessions, but hopefully giving you some kind of ways of training your pelvic floor that is going to be very useful for lots of people who have chronic back pain, but actually it's pelvic floor that's out of alignment. Hope you enjoyed. I'll see you all soon tomorrow morning. Take care. Hwyl fawr.